The mirror doesn't lie. What your gums are trying to tell you. After 50, I never thought that a simple glance in the mirror could completely change the way I saw my own health, but that's exactly what happened to me. It didn't happen overnight. It was something quiet, almost imperceptible at first, a detail here, another one there, until one completely ordinary day. I stopped a few seconds longer in front of the mirror and noticed something that had been there all along, quietly waiting to be seen. My gums didn't look the same anymore. There was a subtle darkening in certain spots, a barely visible recession along the gum line. That slightly swollen, puffy appearance that I'd always dismissed as normal, the persistent bad breath, I blamed it on what I ate. The sensitivity, I told myself it was just part of getting older, but in that moment everything started to connect in a way I could no longer ignore. And that's when I understood this wasn't an isolated problem. It was a signal, a warning, and my body had been sending it for a long time. After 50, everything changes, including what's in your mouth. Let's be honest about something. After 50, the body changes. That's not news to anyone. The metabolism slows down. Cellular regeneration becomes less efficient. Inflammatory processes tend to intensify across the entire body. Hormonal shifts affect everything from bone density to tissue elasticity. We all know this on some level. We feel it, we live it. But what almost nobody talks about is that the mouth, and specifically the gums, is one of the very first places where these internal changes show up in a clear, visible, undeniable way. And the most striking part, those signs were always visible. We just didn't know how to read them. I started investigating more deeply. What I found changed everything about how I approached my daily health routine. I discovered that gum inflammation, known as gingivitis, can silently progress into something far more serious called periodontitis. This is a condition that doesn't just affect the soft tissue of your gums, it attacks the bone structure beneath, the very foundation that holds your teeth in place, and it all starts with deceptively simple signs: redness, bleeding when you brush, sensitivity to temperature, gum recession, and that persistent bad breath that no amount of mouthwash seems to fix permanently. That hit me in a completely different way, because this wasn't about aesthetics anymore. It wasn't about vanity or how I looked in photos. It was about health, about quality of life, about the ability to eat, to speak, to smile, without pain, without embarrassment, without compromise. The moments I didn't even realize were connected. I started thinking back, really thinking, and I remembered so many moments that in isolation seemed completely unrelated, but now formed a clear and undeniable picture. I remember times when I avoided smiling in photos, not because I was camera shy, but because I didn't like what my smile looked like anymore. The gums looked different. Something felt off, even if I couldn't name it. I remembered meals where I instinctively chewed on one side of my mouth because the other side felt uncomfortable. I had normalized that. I told myself everyone does it, but that's not true. And deep down, I think I knew it. I remembered conversations, important ones, close ones, where I held back, kept a certain distance, worried about my breath, where I popped a mint before speaking, where I turned my face slightly away. Those are the moments that quietly erode your confidence, your presence, your connection with other people. Each of these moments felt small on its own, but together they told a story. A story I've been refusing to read. Understanding the real enemy. The inflammatory cycle. Here's where the science becomes truly eye-opening and where understanding the problem becomes the most powerful tool you have. It doesn't start with the tooth. It starts with the gum. When the gum tissue becomes inflamed, even mildly, even in the early stages, the entire oral environment begins to shift. The balance of bacteria in your mouth changes. Harmful bacteria proliferate more easily. The pH of your saliva becomes disrupted. Your immune system responds by sending inflammatory signals to the area, trying to fight back. But chronic low-grade inflammation is a double-edged sword. The very process meant to protect you can, over time, contribute to tissue breakdown. It becomes a cycle. Inflammation leads to more bacterial growth. More bacteria leads to more inflammation. And the longer this cycle continues uninterrupted, the deeper the damage goes, from the surface of the gums to the periodontal ligaments to the underlying bone. And here's the part that makes this especially significant after 50. One of the key protective mechanisms in your mouth is saliva. Saliva isn't just for digestion. It contains antimicrobial proteins, enzymes, and minerals that actively protect the oral environment. It neutralizes acids. It rinses away food particles and bacteria. It remineralizes enamel. But as we age, saliva production naturally decreases. Medications, which most people over 50 take at least one of, frequently list dry mouth as a side effect. Hormonal changes affect the salivary glands. Mouth breathing, stress, and dehydration compound the problem further. Less saliva means more bacterial proliferation. More bacteria means more inflammation. More inflammation means more damage to soft tissue, to bone, to the long-term stability of your teeth. Everything is connected, and once you see the full picture, you cannot unsee it. The signs your mirror has been showing you. Let's talk specifically about what to look for, because many people are walking around with clear warning signs that they simply don't recognize as warnings. Gum recession is one of the most commonly ignored. When your gums begin to pull back, exposing more of the tooth and sometimes the root, it's not just an aesthetic change. It means the gum tissue is losing its integrity. It means the tooth has less natural protection, and it means the sensitive root surface is now exposed to bacteria, temperature changes, and mechanical wear. That sensitivity you feel when you drink cold water, that's often recession talking. Bleeding gums are another sign that people have been conditioned to dismiss. Oh, I brushed too hard. It happens sometimes. No, healthy gums do not bleed. Full stop. Bleeding is a sign of active inflammation. It means your immune system is already engaged in that area, which means the inflammatory cycle has already begun. Persistent bad breath. Not morning breath, not post-coffee breath, but breath that returns regardless of brushing is a strong indicator of bacterial imbalance in the oral environment. The volatile sulfur compounds that cause bad breath are produced by specific anaerobic bacteria that thrive in inflamed gum pockets in areas where oxygen doesn't reach. You can mask it. You cannot eliminate it without addressing the root cause. Swollen or tender gums, even mildly so, indicate tissue inflammation. If pressing on your gums produces discomfort, if they look redder than pink, if they feel puffy or spongy rather than firm, these are signs that need attention. Loose teeth or changes in your bite represent a more advanced stage, where bone loss has begun affecting the structural support of the teeth themselves. This is the stage everyone wants to avoid, and the good news is it is avoidable if you act early enough. The turning point. Understanding is action. Here's what I want you to take away from all of this. There is a moment, and maybe you're in it right now, where you can choose to continue ignoring these signs, to keep dismissing the sensitivity as just age, to keep masking the bad breath with mints, to keep avoiding the mirror or looking without really seeing, or you can choose to understand what's actually happening. And once you understand it, you can act on it, not with fear, not with panic, but with clarity and intention. Because here's the truth that changed everything for me. You don't need a dramatic intervention to reverse early gum disease. You don't need to accept decline as inevitable. The body, including the gum tissue, has a remarkable capacity for recovery when you give it the right conditions. The research is clear on this. consistent. Properly executed oral hygiene makes a measurable difference. That means brushing technique, not just frequency. It means actually using floss and using it correctly, wrapping it around each tooth, going just below the gum line. It means staying hydrated to support saliva production. It means anti-inflammatory nutrition, reducing processed sugars, increasing antioxidant-rich foods, omega-3 fatty acids, vitamin C and D, which directly support periodontal tissue health. It means understanding the cycle and intervening in it at multiple points simultaneously. What actually works? The principles behind real recovery. I want to be honest with you about something. I'm not here to sell you a miracle. I don't believe in miracles when it comes to health. What I believe in is consistency, in understanding and in applying what the science actually supports. And the science supports this. The gum tissue, when the right conditions are restored, can recover, inflammation can be reduced, bacterial balance can be restored, pocket depth can decrease, recession in early stages can be stabilized, and in some cases partially reversed. This doesn't happen overnight, and it doesn't happen by accident. It happens through daily, intentional action, built on a clear understanding of what's actually happening beneath the surface. One of the things that helped me most in this journey was finding a structured approach, a practical framework for understanding exactly where to begin, especially when you're dealing with multiple symptoms at once. Something that organizes the information into a clear, step-by-step progression rather than an overwhelming list of everything you should be doing. That's what I've linked in the first link in the description. Link it a practical guide specifically designed for this situation. If you're experiencing bad breath, sensitivity, gum recession, or any combination of these signs, I strongly encourage you to look at it. It breaks down exactly where to start and how to build momentum from the very first day. Because starting is the hardest part, not because it's complicated. It isn't, but because we've often normalized these symptoms for so long that it takes a moment of clarity to realize this doesn't have to be my reality. The connection you didn't expect. Oral health and whole body health. I want to go one level deeper because this is something that genuinely surprised me during my research and something I think most people simply aren't aware of. Periodontal disease is not just a mouth problem. Decades of research have established clear, statistically significant links between chronic gum inflammation and a range of serious systemic conditions: cardiovascular disease, type 2 diabetes, Alzheimer's disease, respiratory infections, complications during pregnancy, rheumatoid arthritis. The connection is inflammation. The chronic, systemic, low-grade inflammatory state that begins in the mouth doesn't stay neatly contained there. Inflammatory markers enter the bloodstream. Specific periodontal bacteria, like Porphyromonas gingivalis, have been found in arterial plaque, in the synovial fluid of arthritic joints, in brain tissue of Alzheimer's patients. This is not alternative medicine. This is published, peer-reviewed science from some of the world's leading research institutions. What this means for you is both sobering and empowering. It's sobering because it means the stakes are higher than we might have thought. The condition of your gums has implications that extend far beyond your mouth. But it's empowering because it means that improving your oral health isn't just about smiling with more confidence. It's an investment in your entire body, in your long-term cognitive function, in your cardiovascular health, in your energy, your immunity, your longevity. Taking care of your gums after 50 isn't a cosmetic priority. It's a foundational health priority. What the mirror taught me today, when I look in the mirror, I see something completely different than I used to. I don't see problems to hide. I don't see a version of aging that I have to simply accept. I don't see a losing battle. I see information. I see patterns. I see a system that is communicating with me clearly and honestly if I choose to listen. I see a gum line that is stabilizing. I see tissue that is responding. I see the results of daily consistency adding up quietly and steadily over weeks and months. And I see something that I hadn't felt in a long time. Confidence, not just in my smile, although that matters too, but in my understanding of my own body, in my ability to make informed choices, in the knowledge that what I do every single day is making a difference at a level I can see and feel. That's what understanding gives you, not just information, agency. This is your moment. If this story resonated with you, if at any point you recognize yourself in these signs, in these moments, in these dismissals, then this is your inflection point. Not next week, not after the next dentist appointment, now. Because the gap between where you are and where you want to be is not as large as it might feel. The early stages of gum disease are highly reversible. Even in more advanced cases, significant improvement is absolutely achievable. What matters is the decision to begin and the consistency to continue. In the pinned comment, I've shared the method that many people are now using to interrupt this cycle before it progresses further, specifically designed to address bad breath, sensitivity, and the visible signs of gum deterioration through a natural, progressive approach. It's not about extremes. It's about doing the right things in the right order with enough consistency to let your body do what it's designed to do, heal. Subscribe to this channel because over the coming videos, I'm going to continue sharing everything I've discovered on this journey in a practical, direct, evidence-based way. No fluff, no fear, just clarity about what actually works and why. Because at the end of the day, smiling with genuine confidence isn't a distant dream reserved for people with perfect genetics or expensive procedures. It's a decision. And it starts with looking in the mirror and finally understanding what you see.